Okay, so this is a day 4, or yeah, this is a day 4.
Absolutely. See it. Before I go on your recommendations.
See, that's what I mean. I was like, you walk in, it was like no interaction. You just walk in and go, before I go on your treatment recommendation, I'm like, man, where's the humanity? I mean, you come across as unbelievably impersonal. You know, what did I say when you go into the room? What's the common thing you should always say? Remember, I said, how is your day going? Hey, Mary, how's your day going? Okay.
Yeah.
How's your day going? I never want to ask casually how you doing or how you feeling until I'm specifically asking because I want to know on a scale of 1 to 10. Because if I just generally ask them, they'll go everywhere on me. They'll talk about anything and everything. So every time I come in, hey, Mary, how's your day going? All right, scale of 1 to 10, where are we at? Then now after I let them talk a second, I generally try not to follow up and follow them in conversation. If I do, it's something quick and short to cut it down so it just doesn't keep dragging on about how their day went. And in other words, I'm taking back control in the direction that I want it to go instead of following them. All right, Mary, so I'll come in. Hey, how's your day going, Mary? Blah, 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 blah. All right, sorry to hear that. All right, that's great. Man, that was a bad storm last night. All right, Mary, let's check you. Let's get started. That's what it would sound like. Let's get started. That let them know we're going. Let's get started. Scale of 1 to 10, where you at? Say, that's how it would sound.
Yeah.
But it's personable. Okay, so let's see.
For further care, I just want to go over, just review again, the 3 phases of care, inflammation phase, that's what you came in with.
And we talked about, I just want to make sure this is captured for the recording. When you said, let me give my treatment recommendations. And we talked about, you never do that. It's always educating the people and giving them the options. It's kind of interesting, Greg, that we don't have to do any sailing at all because the natural process of healing has the built-in motivators. It's got through permanent problems that restrict and limit ADLs. It's a natural motivator. So I don't have to do any cells at all. I got the natural pleasure motivator. They're getting them back to their ADL. I got the unbelievable greatest motivator there is, or one of the best motivators, a present and future permanent problem. See, I don't have to do any selling. All I got to do is tell them the truth. It's fantastic.
And swelling repair phase, this is a phase where collagen starts to be laid down, basically scar tissue, which has 4 negative aspects to it. And the remodel phase, again, where we want to straighten that area up so it doesn't feel wrong. Again.
See, there you go again. You said you want to straighten that area up. Here you are telling them. Remember when you tell somebody to do something, what's the natural thing they do? Resist. You educate them. Don't tell them. You're just saying this is how it works. They get to make the choice. Don't you push that choice on them. All you got to do, Greg, is essentially, it's literally like this. Show them the carrot, show them the pain, and show them the logic. That's all you got to do. You don't have to tell, because the natural human being will run away from the pain if the logic makes sense to get the carrot. That's all patient education is. And then you're just minimizing the obstacles of making it affordable in time. That's what it is. And don't violate the trust in the relationship. That's all you're doing.
With the repair phase, there's increased nerve sensitivity, which means pain. There's increased nerves getting trapped in that scar tissue. It heals 70% strong and 70% mobile. When you came in, you kind of slept on it wrong. I know you said, but but with the test on the exam, the most positives was number 1 was the joint test.
Okay, we don't need to go over any tests here, Greg. This is day 4. We're not going over any. We're just reminding them of the 3 phases of healing. That's it. Because remember, we're going to go to their test after we finish reminding them of the 3 phases of healing, specifically the 4 negative aspects. That's it. It's quick and fast. What's the very next thing we're going to do? We're going to go through their test. So we're wasting time right now talking about tests. Day 4, it's quick and fast. And let me just share with you what it would sound like. Okay, so if I come into the room, this is what it would sound like. Now remember, it's day 4. They've already heard the 3 phases from day 1 to day 2 to day 3. I don't need to spend a lot of time, and it's a quick check off. It's not interactive, but it is a quick check off. And so this is what it would sound like if you were the patient and I came into the room, Greg. Okay, this is what it would sound like. Hey, Greg, how's your day going? You go blah 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 and say, okay, Greg. Remember, we're going to take time. Let's take an extra 10 or 15 minutes out. Remember, we were going to take time to go over the results of your examination, see exactly where you stand. Now, remember, Greg, before we go over the results of your test, remember your body heals in 3 phases. There's the inflammation, the repair, and the remodel. Remember, you're in the inflammation phase. So right now we want to do everything we can to decrease the pain and inflammation as fast as possible. You remember that, Greg? In other words, I'll throw something back real quick to engage you a little bit, so you're not just sitting there. And said, remember the four negative aspects of healing is if it heals wrong, you can heal. There's increase in nerve sensitivity. The nerves can get trapped in the scar tissue. The scar tissue is not as strong and it's weaker. So that's what happens if it heals wrong. And then, of course, that's the goal of the therapy, is to prevent all of that from happening. Okay. So you remember that, Greg? That I'm done. That's how fast and quick. Day 4, me doing a check off. Then I'm going, now I'm going to go to the mile markers. All right, let's go through your test and see exactly where you stand here. All right, here's the test. When you came in, now I'm just going to go right through the test one at a time. I'm mainly going to focus on those 8 mile markers. I'll itemize it. So how you felt, symptoms, scale of 1 to 10, you were 3. Obviously, that should be normal. Tenderness, we checked tenderness. You were, say, I'm just going to go what it is they had and what should be normal. I'm just going to go through all those tests real quick. And I'm going to do, Craig, I want to do it in the same order that I educated them on the board. So on the board, we had symptoms, tenderness, nerves, and joint tests. So I'll do those in that order because that's the order that I've educated them on day 2 and day 3 to keep it logical and that it makes sense. And then I'll just move on to range of motion, active range of motion. And then we had active range of motion, muscle strength. Then we had the last 2 were the x-rays. So I finish with that. I just use a quick model, use the nerve chart. I'm going to the x-rays. Here's what normal looks like. Here's yours. Can you see it? Okay. That's how quick and fast it goes. Very lean and mean.
Called parental compression. So I take your head over to one side and I kind of do a compression test, and you have positive on that parental compression.
Don't need to be, we're wasting time right here. Don't need to be doing this at all. We're just doing a quick reminder. And then even when I explain go over the results, I'm not going to go into the explanation of all those results. I don't have to because of where I'm at in the relationship. So when I cover the positive finding, I'll just say you have positive joint pressure. That's it. I am not going to have to say and explain how I did the test. Why? Because it's day 4. Where are we at in the relationship? Our trust and confidence is much higher. Defense and resistance are much lower. And we've already covered this topic. Okay, so I don't have to act like it's all new. So I got to start realizing and acting like it's not new. And that's how I got to talk to them.
That's one of the tests, again, that's going to tell us what you have, how well you're responding to care, and then if you deal with kind of tight permanent injury to some degree. The next one was range of motion, real limited on that right side, hard to get over on the right side. That's increased a lot, but we still want to make sure that joint motion increases the most.
Okay, so there's not a clear, apparently you are going into the mile markers, but you see there's not a clear distinction. To me, you're still in the middle of explaining the 3 phases of healing. There wasn't a clear distinction that, okay, here's the quick reminder, and now let's go into your test. In other words, you separate them. In other words, I go to the board and I just point to the board, and then I'm done. Then I want to go and sit down in front of them off to the side, and I like to sit next to them if I have paperwork or if it's on a computer, because I need them to see it. Not just me say it because of the power of visualization. So there's not a clean break here. I'm not even quite sure that you're really started going into the symptoms, because it sounds like you're still doing a review of the 3 phases of healing. Okay, so it's a clean break. Separate them out.
So we don't get heal wrong. Okay. So before I go over the X-rays, let me show you over here.
Yeah, that was a clear run. That was a clear. That was half-ass. That was half-ass. That was. Whew. I don't think I've ever seen anybody run through tests like that. Now remember, you've got all the different test categories that you use. Now, unless you've added some I don't know about, typically there's 8 biomarker categories. Day 4, we talked about the symptoms, tenderness. Okay, so you said nothing about symptoms, what it should be versus what they came in with. Tenderness, you said nothing about that test. Nerve test, you said nothing about the nerve test. You went right to the joint test. And then the next test would be range of motion. That wasn't clear at all. And then the next test would have been the muscle strength test. You didn't cover it at all. And you went right to the x-ray. So you missed all the tests. You went right from the joint test to the x-rays. Stay in the category. Stay sequential. Stay logical. Separate out the board. See, I mean, there wasn't even a clear separation from the board.
So this is kind of a nerve chart. A lot of times when you do have injuries of that lower part of the neck, you have nerves that go.
When you were going over the joint test with her, was it just you saying it, or were you showing her the form, the exam form, or on the computer? Did you have a visual?
When I'm talking to her right now, I'm up at the whiteboard.
When you were talking about the joint test, so it was just your words. You didn't have a visual of the documentation on either paper.
Correct. Right. No.
Okay. Do you see how? Remember we talked about words are only 7% of communication.
Yeah.
Remember we said we want to do everything we can not to only use words. So, Greg, what should have happened is you should have really quickly went through a quick reminder of the 3 phases healing at the board. Then you should have left the board. It's done. I've covered it. I physically leave and I'm done. Then I'm going to come to the patient and I'm going to sit next to the patient, or I'm going to have them come up to the computer if my documentation is digital, because I want them to see it, Greg. Then I'm going to follow each biomarker. Look how quickly you jumped the biomarkers. How many of them you left out?
Yeah, I just explained the positive ones. I didn't go through the ones that were negative.
And why is it important, Craig, to explain a negative test?
Trust.
Credibility. Look how much credibility you lost by only talking about. If somebody only talks about negative things with you, how long does it take before you get defensive?
Yeah, not too long.
What are you doing to her trust right now? You're violating it. Mm-hmm. You build credibility by, remember how I told you it's very powerful. I told you if somebody comes in that's even acute, what did I tell you I always do? Even if they're acute and they had to be helped out of the car to come into the clinic, what did I tell you I always do? In other words, all their tests are going to be positive, right?
Right.
What did I tell you I always try to do? I try to find a normal test to affect credibility, Greg. This test was normal. That's good. See, look how much credibility you're losing. This is important. You cannot just dump on people. You can't just tell them crap. So, and then also, it's not just telling them if something's normal, but what did I tell you if there's a test that's positive, but it wasn't very positive? What did I tell you to say? Tell them it wasn't very positive.
Okay.
Don't magnify the hell out of something that's not. So if somebody comes in and they had just a little bit of tenderness, and let's say I graded it as a 1, okay? Here's what it would sound like. We checked your tenderness. Obviously, you should have no tenderness if you're 100% healthy. We checked your grade, and we graded a 0 through a 3, 3 being the worst. Yours was a 1. So the good news is it wasn't real bad. It was just a little bit. What had just happened to my credibility, Greg?
Yeah, it's good. What up?
Do you understand how this works?
Yeah.
Give them the normal test if it's normal. If it's a little test, if it's low and it's not that big of a deal, tell them. Say it's a positive, but it's not as big of a deal. That's good news. So when you do come back around and emphasize the tests that are important, now how much do they believe you, Greg?
Yeah, more.
Is any of this happening with this patient right now?
No.
No. So you didn't talk to her when you came in. You violated the human part, ran straight to the board, and now you're dumping on her only positive findings. You're a patient sitting there. What's your natural reaction?
Yeah, defensive.
To get defensive.
Down the arm and hand. Some people have symptoms of like numbness and tingling, stuff like that. Even muscular issues with the shoulder.
Now, the other thing that I've noticed, we're about 2 minutes into this. And it's probably not going to be noticeable to you, but it's really bad. What's one thing that's not happening that's really bad right now, Greg?
Dialogue. Getting them to talk a little bit.
Right. Dialogue. Where the hell is she, Greg? Where the hell is she? We don't know. We don't know. Now, I can't see her facial expressions, so I can't judge that. But we'll look, but that's part of the unconscious competence of communication, is not just understanding yeses and nos and things like that, but looking at facial expressions and posture to see if they're with you or not. But here's what I don't know. If she's with me or not. You're not checking her off at all. What's the rule? Every time you got to get micro agreements. You're not getting any micro agreements. So guess what you're setting yourself up for? She may not be with you. You may have already lost her, but you don't even know it. You're just running on. You don't even know it. So guess what happens at the end? And you ask for time and money.
Yeah.
She goes, no. She goes, no, for whatever reason, let me check with my husband, blah, blah, blah.
Yeah.
So we don't have any micro agreements. You don't have the humanity. You haven't increased your credibility. This is kind of classic conscious competence. It's you just like a bowl in a china shop. You're just ramrodding shit through, not even paying attention to the china.
Had anything like that at all? Even in the past? Sometimes you can, just to kind of show you just kind of anatomy.
Okay, that was interesting. I think she said something. Let me hear what she said.
Have you had anything like that at all?
Oh, did she not say what I just said? Did she just say, do you have anything good at all? Is that what she just said?
Some tingling, stuff like that. Even muscular issues with the shoulder. You had anything like that at all?
Did you? I couldn't understand that. Do you know what she said?
That's me saying, did you have any of that at all?
Oh, I thought it sounded like her talking.
No, that was me. I believe she said no.
With the shoulder. You had anything like that at all? Even in the past?
That didn't sound like you.
Yeah.
Okay.
Me.
Sometimes you can, just to kind of show you just kind of anatomy. With the x-rays, let's look at a normal one, okay? The very first thing.
Okay, so see, we got no engagement all the way through this thing. All the way through.
Thing I want you to see is the white.
You know what's happening? This is real classic. You're so worried about the end result. This reminds me, it's a very common thing. It's a human thing that's happening right here, by the way. From a trainer, though, I need to understand this so I know how to train you. You need to understand it so you can do a better job with yourself, as well as training, any associate doctors. But this is a great story, because this is exactly what it reminds me of. When I first worked as an associate doctor, I remember I was there in the first 30 days. I was right out of school. I didn't know anything, nothing. And I mean, I didn't even have any training yet. And the doctor had to go out of town for some reason, because he did all the report of findings. He did all the patient education on report of findings, because I didn't know what I was doing. And then when he closed them, I just treated them, and then he trained me along the way. But this happened in the first 30 days where I didn't know anything. And we had a day 4. So I had to do the report of findings, but I didn't know anything, Greg. And the only thing I was thinking of, I was only thinking of getting him to pay, to accept the recommendations. I put all the pressure. On, in other words, I screwed up everything. I went through everything bad because I was so anxious, hoping that he would prepay. So when he came back, or not prepay, but pay. So when he came back, I could, tell my doctor, say, yeah, I got him to pay, instead of looking like a putz. Okay. Well, guess what? I was a putz. He didn't pay. He didn't stay because I was a putz, because I was too anxious for the end result. I didn't even pay attention to the steps. I didn't pay attention to them because I didn't even know them. But I'm sitting here today telling you the story, and I can still see it and feel it in my stomach. The anxiety that the only thing I was worried about is him to accept the care plan. And of course, that didn't work because I didn't have the skill set to be able to explain it. So let's move forward with this.
Is the bone, okay? The black space is, this basically represents the soft tissue, but x-rays aren't really trying to show you the muscle tends of ligaments. They're more trying to show you the bone. So the main thing I want to look at yours is see how this neck has kind of got this curve to it. See how this neck has gotten straight. And this phase.
Okay, that was a mistake. The first thing that you have to do is magnify abnormal. You should have got her. She shouldn't be looking at her x-ray at all. At all. The light, even if you have it up, the light shouldn't be on that x-ray. You should have gotten her to totally acknowledge the problem with a normal x-ray. That's what always happens first. You never go to their x-ray. So I would have showed her a normal x-ray, itemized it all out, and say, can you see? That's what it should look like. Can you see how that looks? I would have got her total agreement on what I'm trying to show her before I flipped the light on for her x-ray. You didn't do that.
Real quick, I'm not watching her x-ray just yet. I'm using one of the 3 phases of degeneration posters. And
we shouldn't be talking about anything negative. We should just be talking about normal. We're showing the x-rays.
Just go over the normal. Okay. Yeah.
Greg, I want her to see her abnormal x-rays, and the only way I can get her to see abnormal x-rays if she can see normal. That's it. I've got to magnify the hell out of normal. I got to get her to agree. Yes, I see what you're talking about. That's what it should look like. Bam. Then I hit the switch for her x-ray. Can you see that? Okay. Now, if you wanted to, Greg, after I did that, then I could come back to the degenerative poster. After she's seen her problem, then I could come back to the degenerative poster and say, of the 4 stages of generation, you're in stage 2 right here. Can you see that? I can't do it before I get her to agree to normal and see she's abnormal. I can't go to a chart. Why? I can for normal, but the chart's not personal, Greg. I got to personalize it first before I show her the problems with it. So I'm going to emphasize normal, show her hers, get her to acknowledge it's abnormal. Then I can come back because I've got to personalize it. It's got to be her x-rays, not a damn poster.
the main difference, it's still a straighter neck, but you see how it's kind of got a little bit of a bone spur going. And in between, you don't see it. This is a disc space. That's like your car.
They don't see bone spurs. What they see are white pieces sticking out. They don't know that's a bone spur.
Of your spine. Each individual spinal.
Remember, when you talk x-rays, you have to talk at a 3rd grade level, not an 8th grade level, a 3rd grade level. You got to dumb this stuff down. You got to say black, white. I mean, you got to dumb this stuff down.
It has like a little disc space there. Here, phase 3, see how there's no disc space?
See, this is where you've gone off the rail. Why? Because it's not personal. She doesn't even know her problem. She hasn't even admitted to her problem. There's no personalization in this at all, Greg. It's a damn poster you're showing her. I don't give a shit about a poster. Now, after you showed me my problem and I see the problem, then you connect my problem to the poster. Now it makes sense. Otherwise, I don't give a damn about your poster. You understand this? Because it's a poster. It's not me.
So again, that's the same thing as osteoarthritis, spinal decay, major degeneration. Those are all terms of the same thing. So the main thing I want to look for you is again, that curve. Notice the curve and notice the curve of the neck, and this curve is straight. Okay. Now let's look at your.
Okay, you're mixing up way too much. This is too easy to mix up. Number one, emphasize the hell out of normal. If you want to use the poster, that's fine. Okay, no problem. You've got to get her to agree to whatever you're showing her that she sees it, whether it's a curve, degeneration, disc degeneration, whatever it is. Okay, that's where everything starts. Getting them to understand normal. Okay. Boom. The better job you got them to understand normal, as soon as I flip on their switch, they see it. Then I'm going to go, can you see your problem? Now, if you did a good job, most of them will say yes. The very next question I'm going to say is, I'm not going to take for granted. Then I'm going to say, what do you see? It's going to tell me what they do, and not only what they do and do not see, Greg, it's going to tell me the magnitude. How do they say it? Because some patients will, I'll give you an example. I'll give you 2 contrasts of it, showing it. Some patients, you'll flip it on and you go, can you see it? And they go, yeah. See, that's one way. I flip it on and go, can you see it? And they go, yeah. Well, I said the exact same word, but they had 2 totally different connotations in how the patient saw it. So it's not only the words, but how they say it. So I'll say, can you see it? I'm going to listen to not only what they say, but how they say it. Then I'm going to say, what do you see? I want to make sure that we're talking about the same thing. What do you see? Well, it's this. I see where it's and then I'm listening to how they say it, because it's going to tell me the magnitude of how they perceive it. They go, well, it's this. I say, that's exactly right. That's your problem. Click. I just turned it off. I'm done. That's how fast their x-rays are over. Now I personalized it. Now I can come down to my chart, which is totally fine. And it's good to do actually now. But now I've personalized it. It's not just a damn poster anymore. Now I can come to the chart and go, do you see right here, you're at stage 2 or stage 3 of spinal degeneration. Can you see that? Yeah. Boom, done. That's how that works. You can't do what you do. You can't jump around. You can't show them a poster, show them abnormal posters. You can't do that. You have to personalize it. Remember the 3 phases of establishing need. What are 3 things that have to happen to establish need? Number 1, admit. You'll never get a person to admit their problem as a poster. So you've got the personalization is from showing them their x-rays. Now it becomes real. And then you put it into perspective with the spinal poster. Now it becomes real.
Okay.
But in summary, this is too easy. Emphasize the hell out of normal. Don't talk about anything else. That's 90% of your conversation, Greg. 90%. That's what gets them to see abnormal. I can't talk somebody into abnormal, Greg. It's a hell of a lot easier if they see it as opposed to me trying to talk them into it. I don't want to try to talk them into it. I just want them to see it because it's way more powerful for them to see it than it is for me to try to talk them into it. That's why I got to magnify the hell out of normal. So 90% of your time on normal, don't talk about anything else on that spinal degeneration chart. Can they see that, what you're getting ready to show them? Okay, good. Got it. All right. Flip the switch on for theirs. Can you see it? Yes or no? If they can't see it, then you got to go back to the normal. Turner's off and you got to go back to normal. Then you got to re-emphasize normal. Then Turner's back on to get them to see the contrast again. If you did a great job showing them normal, in other words, you emphasize the hell out of it. When you hit that switch to turn that light on to show them their x-ray, you should get a reaction like this. Oh, that's mine? Those are the kind of reactions you should get. And then I'm going to go, what do you see? And I just want to confirm what they're seeing. And I'm going to interpret the magnitude of how they're seeing it based on the words they say. I'll reconfirm. That's the problem. Click. Go back to your spinal degeneration chart. Based on your x-ray and the 4 stages of spinal degeneration, can you see you're right here? You're in stage 2. Done. We're done. Move to the next subject. That's how easy this is.
I've done this before, but I'm straightening out.
Okay, okay. We can see this up there. Okay. All right. Do you see it? Kind of the straighter neck there. Okay. And the main portion of yours is kind of in this, I do measurements on around this, there's 7 bones in the neck, 1 to 7. Okay. And again, this is the back, this is the front, right? So
this shouldn't be going on. All of this should have happened in the beginning. All of what you're doing right now should have happened in the beginning to get them to see normal. You minimized it. You minimized the impact of normal by doing what you did.
the fifth one down, okay, is the major one that's out of alignment. And to not get too specific, it's the major one going back, which making that curve straight. Does that make sense? Okay. And that's what locks up over time. Okay. The good thing is I don't see a lot of spinal decay going on right now. You shouldn't, or anything like this. The main thing is it's going straight. All right. So before I go to recommendations too, we have 2 different policies in this office. We try to make it easy.
Okay. So my question right now would be how well, based on her responses, do I think she sees the problem and understands it's a problem? Based on her responses, Greg. Here's the responses I heard from her. Mm-hmm. Mm-hmm. What does that tell me? High effective communication going on here? No. I don't even know what that means. Mm-hmm. Uh-huh. I don't know what that means. I got to get more out of her. That's not enough for me to interpret. Do you see it? Do you not see it? The magnitude of it? To me, and by her going, I don't even know if she really sees it or understands the magnitude of it. What does that mean? I can't move on. I can't move on.
Easy on patients with their time and money. Okay. Remember over the time, we have a policy. I don't think you wait much at all. We don't have patients wait. You get right in. We have like a less than 5-minute wait policy.
Whatever you're going to choose for your policy, 5-minute, whatever it is, stick to it. If you're going to say 5, always say 5. Don't generalize. Don't say 5 or 7. Don't say sometimes. You got to be specific because it creates more authority that it's true than just saying, oh, we have as, in other words, magnify the hell out of that 5 minutes if you're going to say 5. Don't minimize it. That's why I say 7. We have a 7-minute wait policy. It's not casual. It's a damn policy and it's specific. It's 7. Okay?
Usually we're open early, we stay open late, 8 to 6, so we can get into this work. And then also, usually our treatments are like 15 to 20 minutes, give or take, so they're going to happen quickly. With money, we want to make sure we try to get our health.
Okay, so you covered 2 of the 3 time elements. And what do I not like about what I'm hearing from her, Greg? This should be a red flag to you. If you were in a state of unconscious competence, this would be a red flag. What is it? What are you hearing? That should be a red flag.
Just nothing from her. No dialogue.
She's mumbling.
Yeah.
We are not hearing clear yeses and nos. She's mumbling. Guess what that's telling me?
She's not with me or not buying it.
Right. That's what it tells me. That's what it tells me. Because somebody that's with you and buy it, how do they sound? Well, first you can hear their words.
Right.
And they're sharp, authoritative words. She's not even using words and she's mumbling. So guess what I know is happening right now? She's not with you. You lost her. But we know that from the very beginning, because at any time from the very beginning, did you check her off with authority?
Check her off.
Did you reverse her and she come back with authority, with authoritative acknowledgement with the check off, with whatever topic it is you were checking off?
No.
We haven't heard it from her at all. What's that saying about her trust in you?
It's not a lot.
We're not seeing a lot of trust. She's not with you. Can you see this, Greg?
Yeah.
Pulse down low, okay, to where it can even pulse that's relatively 47 every other week. Okay, so it's real low. So again, we have to deal with those obstacles time and time.
And I already tell you, it's not going to work just because, we already know she's not with you. We're just talking in the wind right now. This is, again, when you're in a state of conscious competence and you cannot even see what I'm pointing out because you're still trying to think of what to say next. You can't see that you didn't check her off. You can't see that she's mumbling. You can't see that she's not giving definitive answers. You can't see that you're not checking her off. You can't see any of it because you're in a state of conscious competence. That's why you got to get out of that state as fast as you can so you can see this stuff and hear this stuff. And you already know what to cover next, but now I can start paying attention to the patient, go, oh, she's not with me. She's not verbalizing. She's mumbling. I got to stop and reinforce what I just said to see if she's with me or not. That's the difference between being a black belt, unconscious incompetence versus conscious competence. So from the very beginning, she's not with you. There was no indications with her at all, verbally, that she's with you at all.
With that being said, with the inflammation repair and model phase, what phase?
Remember I told you, you never close a patient at the close. It's micro agreements all the way up to the close. You get micro agreements up to it. So we can't not have micro agreements and then expect at the end go, yeah, I'll spend time and money. No, you got to get micro agreements all the way up to that point. That's when they easily go, yeah, I'm in.
Right.
So Kara, would you like to get your neck to or back to normal?
I mean, ideally the remodel, but.
Oh, the big but. Okay, so guess my ears are going really big right now. I got it now. When she said but, and she starts talking, what am I listening for? There's 3 things I'm listening for. What are they?
Need time or money.
Major, minor, or bullshit. Is it what's getting ready to come out of her mouth? Is it a major topic? Is it minor, or is it bullshit? Major is need time or money. Okay, now we're in the time or money category, so I'm going to suspect that that's probably what's going to come out of her mouth. Minor is it's clinical. It's typically a clinical question. It's not a money or time or need question. So it's important. It needs to be answered, but it's not a deal killer. Need time or money is going to kill the deal. And then there's just BS. Is she going to say something that has nothing to do with need time or money and nothing clinical? If that's the case, I don't even have to address it. Just check it off and go on. So she says, but let's see what happens.
Honestly, just to the point where it doesn't hurt and I have the range of motion, just because I don't have a lot of time, and I'm trying to buy a house, so the money isn't really something that I'm wanting to spend if I don't have to. So probably the repair.
Okay. Well,
All right. So what's the good news that just happened, Greg?
I got feedback.
Well, you got feedback, but my impression is I got the impression in how she said it and what she said that she was honest. I got the feeling that what she said was honest.
Yeah.
So she didn't lie to you. So many patients, when there's time or issues money, they won't tell you their time or money issue. She told you, I got a time issue and I got a money problem. That's unbelievably rare. I mean, I'm thankful when they tell me it's a timer because most of the time it's let me think about it. Let me check with my spouse. In other words, they lie to you.
Well, as you keep playing the tape, I felt at the time she was just wanting to get out. You need to hear a little bit more of the dialogue. She does go back to she needs to talk to her husband.
Okay. Well, I'm going to tell you because it wasn't handled right. So she just told you the time and money was the issue. And we already know time and money is the issue, right? We already know these things.
Right.
But she magnified them. So what happened between now and the previous 3 days? And because remember, I have not heard the previous 3 days, but I have heard today. So I heard how you interacted with her today. So I'm going to assume that's how you interacted with her on day 1, 2, and 3. Is that a fair statement?
Yeah.
Okay. So guess what I'm going to assume? Guess what I'm going to assume when I hear this on day 3? I'm going to assume you didn't get micro agreements on day 3 and day 2 and day 1. Is that a fair assumption? Is that like a logical, fair assumption?
Yeah.
Yeah. So I'm going to assume that you never had the micro agreements up to this point. And so here you are. And so time and money is magnified because you didn't get the micro agreements on day 1, 2, and 3. Now, the great news is she told you the truth. I feel she told you the truth. So guess what I'm going to do? She just told me money's an issue, time's an issue. Okay. So how do we handle that? First thing that we do is acknowledge it. I can understand how money can be an issue. I can understand how the time can be an issue. I can appreciate and respect that. I'm going to go into agreement first, because when you go into agreement, what does that do to their defenses, Greg?
Lowers.
So the first thing I'm doing is going into agreement. I can appreciate and understand that. The next thing I'm going to do is go back, and I'm just going to cover the clinical part. Let me understand that that there's a difference between the time and money versus the problem. So we understand you're having a neck pain. It's and I'm going right to the ADLs, and it's affecting you with these were the tests, these were the ADLs. So we understand that, right? Okay. So now we're at time and money. So guess what happens, Greg, when I handle time and money right now? She stays. All I got to do right now, Greg, is it's called bond at the lowest level. I got to go to where she's okay with money and time. That's all I got to do to make this work. Does that make sense?
Yeah.
Now, I may not. Now, she said repair phase. I may not, because she already knows the time and money. So she said repair phase. So guess what my recommendation, when I go to the board, she goes time and money. I'm going to go, listen, I understand time and money's deal. And I tell you what, we'll make sure that both of them work out for you. I'm going to go to the board and I'm going to do the math. I'm going to come down with the visits. I'm not going to do repair. Why am I not going to add in repair when I do the math on the board now? Or excuse me, the remodel phase, not repair. Why will I not include the remodel phase when I go to the board?
Because you're going with her, you're agreeing, you're coming to her level. That's what she wanted.
Yeah, she just told me that.
Yeah. So
that's what I'm going to do first. Okay, so I'm going to acknowledge her, go into agreement with time and money, confirm the clinical part. And then I'm coming back. Do you understand there's a difference between the clinical, the problem, and time and money? Do you understand those are different issues?
Yeah.
So I'm going to come back and make sure there's no confusion and that we're agreement on the clinical part. This is your problem. This is how it's affecting your ADL. So we're going to get an agreement on that outside of time or money. We're going to agree to time and money that it's a problem. I'm going to nail down her problem. Then I'm going to come back and say, no problem. I can understand that. Here's what we would be looking at. I'm only going to put the time and money up for the repair phase. I'm going to do everything the same with the repair phase. Okay. Now I'm going to have a lot lower time and lower money. Now, guess what I would probably also do with her, saying that it was that time and money was even a much more important deal, and that I don't want the remodel phase. Guess what I'll do?
I don't know.
I'm going to go for the first re-exam, Greg. I'm going to shorten time and money and only get an agreement to go to the first re-exam to check her biomarkers at the first re-exam to see if they're getting better, worse, or staying the same.
Okay.
And guess what she's going to say? Guess what I just did to time and money?
Yeah. Dropped it.
Significantly, but I still have her as a patient, right?
Right.
And I third-partied it. It's the biomarkers. So I'll do the repair phase, put it all up there, do all the math, but then I'm going to cut it down and say, but I understand that time and money is an issue for you. Probably an option that I might consider is we would only treat you 3 times a week for 4 weeks, redo your test. When we redo your test, that'll tell us if you're getting better, worse, or the same, or whether or not you're headed toward a permanent problem. So it would cost you a lot less time or money, and you would see how you're responding to care. Will that make it work for you? That's exactly what it would sound like. In other words, I have to find a demarcation, a point. I'm not going to try to sell her on the repair phase. And she already said time and money. And I already know when I go to the remodel phase, I know when I go to the repair phase, that's still going to be a high probability of no. So I need to go really strong with third-party objective findings. And what's that called? It's called a re-exam with the biomarkers. It's not your opinion anymore. Remember, we cannot tell them our opinion. Do you understand this? I'm leaving it on them. So I'm just going to go for the third-party biomarkers. First re-exam. What we would do is, she saw the, way more visits with the repair phase, but I'm even after I did the 20, all that, I'm going to come down shorter. So I tell you what, since time and money is an issue with you, I can appreciate and understand that. Probably you might want to consider a modification. Maybe we just work with you 3 times a week to see how we can affect all your tests, see if they get better, worse, stay the same, or if you end up, if they're heading toward a permanent problem. And then we would just redo all the tests in 4 weeks, and that'll tell us exactly where you're at. And that way you don't have to spend a lot of time or money and still see how the tests are going. Will that make it easy for you? That's what it would have sounded like, Greg.
Okay.
Now, what's the likelihood that I'd have a higher chance of getting a yes now? If she knew it was only 3 times a week for 4 weeks, and then I did the math. Now remember, I'm going to do the math, right? 3 times a week for 4 weeks, 12 visits, whatever your visits are. Am I still going to give a 20% reduction for her to prepay till the first re-exam, Greg?
Yeah.
You're damn straight I am. Because when people don't prepay, what do?
Drop out.
Especially her. She's already dropping out on you right now.
Yeah.
So I'm going to give her 20% off that. And then I'm going to take that and I'll whatever it is, if she doesn't say yes to that, Greg, I'll spread it out, right? I may spread that out over 2 months to even make it easier instead of 1 month, right?
Right.
I may do 4 payments. I'm going to spread it out to maybe 2. If she goes, so it'd be 2 payments of X, and she goes, can't do that, then I would even add on another month, which would be 4 payments. In other words, 2 weeks, 4, it'd be 4 2-week payments. So what did I just do to the amount of money?
Yeah.
I just cut it in half. Okay. Now, Greg, she says no to that. What would I do?
Go to another lower level that you can find agreement.
Exactly right. Because I'm already losing the patient right now, right?
Right.
So if I don't go to a lower level of the agreement, what's already been agreed upon at this point? She's leaving.
Oh, yeah.
You've already lost the patient. So if she doesn't agree to 2 months of 4 payments, which significantly reduces the money, I'll go to 3 months. Now, when I go to 3 months, what am I really checking for now?
If the need is really there.
I'm going, how much of a real issue is the money? But before I let it go, I'll do that twice, Greg. And if she goes, no, no, and here's what I'll do. What frequency and what amount of money payment will easily work for you? That's the very last thing that I say, Greg. I understand time and money is an issue. What will work to you so we can treat you at least a minimum amount of time and check the mile mark, check your test at the re-exam. Is there any frequency that would work for you? Once a week, twice a week? Is 3 times too much? And is there any amount that will work for you? I'm just going to go, it's called bond at the lowest level, Greg. I'm going to go to the lowest level of each of those categories, just the agreement, because I've already been guaranteed I've lost this patient at this point, haven't I?
Yeah.
So I'd rather get something than nothing, right?
Right.
And what's the likelihood if she sticks with me for 2, 3 weeks, 4 weeks, that maybe she has a relapse, it gets worse, she has a family member that's in an auto accident? In other words, what's happened to my potential by just keeping her for, even if it's 1 visit a week or 2 visits a week or 3 visits a week for the first re-exam? What just happened to my potential versus her just walking out the door?
Yeah, it goes up.
So the last thing that you always do is you go to the agreement of it's called bond at the lowest level. You go to the lowest amount of payment and time that would work for them. That's what you do. Does that make sense?
Yeah.
But you never do that until the 3rd resistance. Now, I'm real careful not to teach new doctors what I just told you. Why?
It's more confrontation you got to get into.
Yeah, the new doctors will bail out. They'll do that way too quickly. They'll bail out and scale down way too quickly before just increasing their skill level and getting people to pay. See, what right now has to happen is not lowering the time or money. That's not the real issue based on what I heard. Your interpersonal relationship is the problem.
Okay.
I didn't hear her check off on anything.
Yeah.
She was I don't know if now we know she wasn't with you at all until you made her until at the end you made her give a decision. Well, guess what all that mumming was for now? When she goes, now we know what it was from, don't we?
Yeah.
There you are. So I'm always, Greg, I'm going to do my thing, first resistance, second resistance, right?
Right.
But by the time I get to the 3rd resistance, I'm totally turning it over to them. What would work for you? Once a week? What kind of payment would easily work for you? I'm going to go to the absolute lowest level of time or money. Now, she said time and money, so I'm going to deal with both of them. If there was only one issue, time or money, that's the only one I'd focus on. But she said both. So I'm going to acknowledge them, accept them, appreciate them. And then I'm just going to turn around and go, what would work for you? But I have to do 3rd-party objective findings with a target. What's that called? Some type of periodic treatment that leads to a re-exam. I have to have a target out there. I have to. And the target is the 3rd-party objective findings. That's going to tell us whether you're getting better, worse, staying the same, or if it's leading to a permanent injury. And out of everything that I just said, the last phrase was the most important, or if it's leading toward a permanent injury. That was the most important phrase out of this phrase. It's going to, the re-exam, and when we evaluate those tests, it'll tell you whether you're getting better, worse, or staying the same. That doesn't carry much meaning. The impact of that whole phrase is, or if it's leading toward a permanent injury because of the pain motivation. So it's third-party objective findings, time and money, bond at the lowest level. You see how that works?
Yeah.
All right. Any questions about that?
No.
Let me just play this on and see how it plays out.
For thinking about the time and money, is the time available to you to do what you've been doing?
Not really.
Okay. Are you having missing work or something?
Yes.
Okay. Good question. What would be the very next question I would have said with time, Greg? But I can't go there yet. I've got to have a target. See, right now there's not a target. I've got to introduce the re-exam and the findings and the potential negative consequences of the findings, the target. That's what I got to do first. I got to bring it in. Then I can go in and go, what would work for you?
Okay. Well, again, 3 times a week is what I kind of want to start at, and again, you'll be here, relatively, I can channel within 10 minutes in the house.
Can you see how there's no emphasis on the target?
Yeah. So you mean I should go back up to the board to the 3 phases or the tests, the biomarkers?
Craig, everything is about third-party objective findings, pleasure, logic, fear. Everything. That's what you base everything on. That's what you go back to.
Go back to that. Okay. All right.
Because that's what everything, in her mind, there's not a short-term target with high negative consequences.
Right. Okay.
I got to remind her of the short-term target with high potential negative consequences. That's called the tests at the re-exam. Well, when do you evaluate tests at re-exams?
Every 12.
Yeah, every 12 visits. So basically every 4 weeks, 3 times a week, 4 weeks. But right now, can you see there's not a target for her?
Right. That's what I'm asking. I should have reminded her of the target of the positive test.
No. I'm bringing back, we already know time and money is the issue.
Right.
So I told you I'm bringing it back to the first re-exam to minimize time and money to get the agreement.
Oh, okay.
Because I've already lost the patient. So I'd rather just go for the first re-exam now, right?
Right.
I'm not even worried about going through the repair phase. I'm just going, let's add up the visits to get to the re-exam, and that's going to tell us whether you're getting better, worse, or staying the same, or if it's heading toward a permanent injury. You see what I just did?
Yeah.
And then if that's not an agreement, then I'm going to go back to, well, what would work for you? Frequency, twice a week, once a week, roughly? She said once a week. Would I take it, Greg?
Yeah.
Yeah. And then same with payment. I'll do the math. 3 times 4 is 12 times whatever your visits are. If it's 50, whatever, subtract out 20% for the prepay. And I'm going to divide that into 2 payments and see if that works. If not, then I'll divide it into 4 payments. See? 1 payment every 2 weeks for 2 months. You see how that works?
Yeah.
I'm okay going 1 month, only 1 month past services. 1 month. I'm okay with that.
Yeah.
And what did I just do with time and money? If she goes, well, I can come in twice a week, and then I take the money down to 4 payments instead of 1. What did I just do with time and money?
Yeah, just lowered it again. Yeah.
You see, there's got to be a goal. There's got to be a target. Do you move forward if there's not a target? How well do you move forward, Greg, if there's not a target for you?
Yeah, it's hard to.
How easy is it if you understand the target and there's pain and pleasure consequences and there's third-party objective findings when you reach the target? Now, how much sense does that make?
Yeah. More. Yeah.
That's why whatever you do, Greg, always go back to the test and the 3 phases of healing, and they're evaluated at the re-exams. Whatever a patient says clinically, that's always the answer.
Okay.
I can't tell you all the questions patients will ask. They'll ask a bazillion questions clinically.
Yeah.
Bottom line is it depends on what the tests are. That determines your diagnosis, your therapeutic protocol, how you're responding to treatment, whether you're getting better, worse, or the same, or ending up with a permanent injury. That's my answer for every clinical question. Do you understand this?
Mm-hmm.
I just told you how to handle a million clinical questions from patients.
Yeah.
Stick to your guns. I can't give you a canned line for a million questions, can I?
No.
But I can tell you to stick to your guns. It's their care is based on their test, relative, and then it's evaluate the 3 phases of healing. And when and where are they evaluated? They're evaluated at the re-exams. That tells us not only the diagnosis, they're getting better, worse, staying the same, and if it's going to end up with a permanent injury. So the main thing that's missing for her right now is a target. Okay. The good news is you're sticking after it. You didn't give up. So now you're going for time, but you don't have a clear target with her right now. In other words, you didn't bring time and money in.
I got you. Yeah.
If time and money were off the table, would you want to get to this remodel phase? Yeah. Okay. Well,
okay. Which is true. She said that. So that was, by the way, Greg, that was a very good statement. That took confrontation. That took skill for you to say that. That was good.
Let's take it through it. With the repair phase, usually lasts 6 to 12 weeks. Okay. I'm putting you at the lower end because of your X-ray, your age.
Now you can do all this, and I would, but after I do it, I already know it's too much time and money. I'm going to come back and go for the re-exam after I do this with time and money. So I'm going to do this, but after I do it, I already know time and money is the problem, Greg. So I'm going to lower it to the first re-exam.
There's 2 different aspects. There's our age and also how long we've had the problem. Okay. So at the repair phase, again, this is where we're making sure
the other thing that's happening right now is she could totally be blocking you out for one reason. You did not agree with her.
Yeah, I think that's, yeah.
You should have
trying to establish need again. That's why I'm going back to the repair phase.
Yeah, you should have went into agreement with it. I understand and I can appreciate. I mean, that's what I say. I understand and I can appreciate. Those are the 2 words you always say with time and money. I understand and I can appreciate how money or time, whatever the topic is. I understand and I appreciate how that can be an issue. That's what you always say when there's time or money. Go into agreement.
These 4 negative aspects don't happen. At 6 weeks, I would want to work with you 3 times a week. So 6 times 3 is 18. Okay, 18 visits for the repair phase. This phase here lasts from anywhere from 9 to 36 visits.
That you shouldn't even be talking about remodel because she said no. That should be off the table. You should not even be talking about it. So I'm at repair. You're okay with where you're at, but I also know that's not what she's going to stick with. I'm going to the first re-exam. So I'll do the math, but then I'm going to shorten it more to get to a point in time. How much easier is it for us to do something that we don't want to do if it's not very far off in the future? How much easier is it to do it? It's a lot easier to do.
Yeah, I'm going to put you at the lower end because of, again, your test, your age, how long you've had it. Okay, so at 9. So 9 plus 18 is 27. Does that make sense? So at the cost, 27, we're going to put it at 47.
Okay, that time won't do it. And you didn't get the agreement. And there was no reason why. So there's going to be a reason. You got to put a flag in the ground, and there's going to be what's the flag in the ground? Re-exams. What did I tell you when you're going through with patients and they're feeling better and they question your care? What did I say? Stop, base it on how they feel and modify their treatment? No. So we'll know at the re-exam. So we'll know exactly how you're doing at the re-exam. We'll go through your test, compare them to your first test. That'll tell us if you're getting better, worse, the same, or if it's ending up with a permanent injury. That's the answer to everything. Because in truth, that is the answer.
Is it? Okay, so 27 plus times 40.
So you change subjects without there being a target. Can you see there how there's no target, no real target, right? I mean, there's quasi, you're kind of using the repair phase as the target, but it's still too far out. It's not a flag in the sand. A re-exam is a flag in the sand.
7, again, I wrote this all out, comes to 1269. Okay, and that covers everything, all treatments, all therapies.
But it's not going good because you left time. You didn't get the agreement with time. You left it, and now you want the money. So this is not going to go good.
No extra costs after that. There's no extra costs. be a problem, okay? So we do a 20% prepaid discount, okay, if you prepay. 20% of this is $254, which takes it down to 10.
See, even in the beginning, after I agreed with her, I go, I'll tell you what, let's see how we can simplify this and make it work for you really easy. If you were the patient, how would you have liked me agreeing with you and then said, let's see how we can make this really easy?
Yeah.
Yeah.
That's good. Yeah.
You see, are you going to listen to me now?
Yeah.
Yeah.
15, okay? Your treatment will last, it'll start off kind of intense at 3 times a visit and then break down to once a week to one area.
You don't want to get into that at all, Greg. Remember, 3 times a week, twice a week, once a week. Yeah, I mean, she's not even in an agreement with you. Can you see how you're just talking into the wind right now?
Yeah. I was focused on just doing the presentation of the visits and cost instead of really dealing with what her obstacle was.
Yeah, I'm with you. You're in conscious competence. I'm with you. But can you see how she's not with you at all?
Yeah.
Yeah.
Per week, okay? So you're going to be around, at 27 visits, around 6 months, okay?
This is like talking to a door. She's not with you at all.
Yeah.
If you take that 6 months and you break it into every other week, okay, like bi-monthly payments, that gives you 12. Does that make sense? Okay. So 12 divided by 1015 is going to be 84 every 2 weeks.
Now, I guarantee you, she didn't think it would be that cheap. $84 every 2 weeks. I guarantee you.
Does that make sense?
Yeah.
How I got that? Okay. So will that work for you?
I'm gonna have to talk to my husband.
Okay.
Okay. She just lost. She just gave up on you is what she just did.
Yeah.
She just gave up on you.
Okay.
And it was really all from micro agreements. You didn't get the micro agreements going all the way through. And so it wasn't handled there at the end. And she just gave up. Do you see how she just gave up?
Yeah.
When she said, let me talk with my, she was done dealing with you and just gave up.
Mason, print you off a copy of this, okay? You understand how we got that number? Okay. And give it to your husband. If you have any questions, again, you can call us and everything.
Now, the one thing that you have to understand when that happens is you have to understand it's over and you lost the patient, okay? If your self-talk keeps saying, oh, they may come back or they'll probably come back, okay? You'll never increase your skill level if you lie to yourself.
Yeah. I'm not.
What you need to understand is when people say, let me check with my husband, you need to understand it's over. Okay. That means it's all on, you go for bare right now. So what's the bare minimum you would say right now? This is the last ditch effort right now to create the deal. We already told you that it should have been handled. When she said that, you should have just brought it into the repair phase and then went to the first re-exam and then did the time and money, reduced it to the time and money, extended it to make it easy, and then went with the agreements. If she didn't want to do 3 times a week with time, would 2 times a week work? If not, with once a week. If once a week doesn't work, with once every 2 weeks. In other words, I got to keep reducing it until I get an agreement. Do you understand this?
Yeah.
I'm not saying that it's right. I'm saying I'm just going for an agreement.
Right.
And then I'm going to do the same with money. So this is the money. If that doesn't work, I'll spread it out. That doesn't work, I'll spread it out. Then the next thing I'll do is I'll just drop the money. So how about now? So now it's all over. She said, I'm checking with my husband. Okay. So what's the last thing you're going to do to try this? Because you already know it's over.
Yeah.
So what's the last thing I'm going to do to try to get an agreement with her before she walks out this door and she just third-partied her husband?
I would say what would work for you?
Close. You're close. Here's what I'm going to do. I'm at the total end of the rope here. I can appreciate and understand. Again, we got the agreement with the issue, the problem. She knows the problem. I'm going to get the agreement with time and money. We went through this. I'm going to say, well, I can appreciate that. Let me ask you, and I really respect and understand how time and money is an issue. And we can work with you to make it happen. Let me ask you, what amount of money would, in other words, what amount of payment and what amount of visits would work when you went home and told your husband that he would say, yeah, that's no problem? What would that be?
Yeah.
I just asked for the yes. Because soon as she says, well, it's this or this, then I'm going to turn around and go, I'll tell you what, let's go ahead and do that if that's okay with you. You say it's going to be okay with your husband. I'm okay with that if you're okay with it. Will that work for you? In other words, I'm asking her to go, give me the terms that your husband would think is totally okay. That's what I'm going to do right now. Because I'm at the end. Do you understand this is the end?
Yeah.
I'm now going to ask for the person she's going to defer me to. I'm going to ask for his okay. What money would you think would be told if you told him it's this per week? And I'll even say, do you think it's 40? It's 84. Would it be 60? Would it be 40? Would it be 30? What number do you think that you asked him and he said it's okay? That's what I'm going to try to do.
Okay.
The same with time. How about time? What frequency do you think would be okay for you and him that you go, hey, this is the frequency and it totally works for you and him. And it's not that big of a deal. Would it be 3 times a week, twice a week, once a week, every 2? Just roughly. Okay. Now here's the deal. When you get to that point in the conversation and they don't go into agreement on you, what's the real issue?
Either need or they're not trusting or believing you.
It's trust.
Okay.
Because money and time's not the issue anymore. I just took money off the table and said, hey, whatever money it is you agree to and he agrees to, and what time that you agree to and he agrees to. See, I totally turned it over to them and said, that'll be the agreement. It's no longer time and money, it's trust. And when they don't say yes to that, it's a trust issue. Because you're essentially saying, I'll make money work for you and your husband, and I'll make time work for you and your husband. And she just blamed it on money and time and let me check with my husband. So as soon as I put that on the table and okay it and remove it, where else can she go? Except say yes, unless there's another problem. When they don't do it now, it's trust. Now, based on what I already heard, it's really micro agreements and trust right now. In other words, time and money is not the issue right now, Greg. She just doesn't have the trust in you.
Yeah, that's what I thought at the end of the day too.
Yeah, that's where you're at. Because if the need and time or money were the issue, and she trusted you, she'd be thanking you right now.
Right.
Because that's what patients do. When I do that and they trust me, and I make it work for them, they're happy and thankful, Greg. She's not happy and thankful. She's wanting to get out of there.
Right.
You got a trust issue. Where did that happen? I don't know what else happened, but what I do know is you didn't have some personalization there. You didn't have micro agreements all the way along the way. So you lost her way before this. This wasn't the problem. Can you see that?
Yeah.
Any questions about that?
Yeah, I would just want to dive into more trust. I'm deep for the time now, but what am I doing? What establishes trust? I know from day one on, but
well, the first thing, now I don't know what happened in day 1, 2, or 3, and I'm going to assume you didn't violate trust because you showed up for day 4. So the first thing I'm going to assume is you didn't violate trust. What you did do is you didn't get trust along the way. You didn't get the micro agreements.
okay, that's the main thing, micro agreement. Okay.
Based on what I'm hearing, how you interacted with her in this day, because you had no micro agreements with her at all. And matter of fact, you didn't even treat her as a human being when you walked in the door.
Let's say, just an example. Let's say I have a day 2 and I'm going over something, and when I do ask for a micro agreement, like, does that make sense? If they're not with me, I can't go on, right?
That's correct.
Okay, that's what I'm doing. I'm just talking. Yeah, that's what I'm doing.
Yeah, but Craig, that's common when somebody's learning something new and they're trying to think of what they're saying. That's called conscious competence. You can't see. A good analogy is, remember when you first started riding a bike, did you pay attention to the roads and the sidewalk, or were you looking at the bike?
No, yeah, just the bike, yeah.
See, right now you're looking at the bike, Greg.
Yeah.
But that's why we listen to these tapes. Would I ever have been able to find out as much information as we did if this would not have been recorded?
No.
Look how much information we got because this was recorded.
This is what I needed to hear. Yeah.
This was a ton of information we got out of this. Now, the good news is we highlight it with you. We emphasize the things you didn't do so you can stop doing that. Now, if you were in my office training, guess what I'd be doing? Guess where I'd focus all the emphasis with you if I were training you right now?
Just role playing, dialogue, making
No.
agreements.
The big one is micro agreements. You've got to stop and get acknowledgments before you change categories. That's number one. And then I'll beat you up a little bit about the dialogue coming in and saying, how's your day-to-day, Mary?
Yeah.
You know, talk to him like a human being, but that's not as much. I mean, that is part of the equation. You don't treat somebody like a human being, their defenses go up. So the first thing is I'm going to emphasize with you, if I'm training you, I'm like, damn it, you stop. When you change a category, you're not allowed to move to the next category until you turn to that person and say, does that make sense? And they have to verbally say yes or no. They can't mumble it.
Yeah.
If
Okay.
they mumble it, you got to ask them again.
Right. Yeah. Okay.
And if they don't agree with you, you can't move forward and go, then you're going to do the rescue question. Looks like I'm confusing you. What part of this am I confusing you with? So I can clear up before I move on. But that's the main thing that I'm hearing is micro agreements. The second thing I would do is day 2. And then the third thing that didn't have much to do with, the dynamics, how you went through the introducing day 4, the quick review on day 4, the 3, that was crap. How you went through her biomarkers and you didn't even cover the normal ones, that was crap. And then how you did the x-rays, that could have been cleaned up. I mean, it should have been quickly 3 phases of healing, sat down and showed her, and where it was visual with the test. You should have stayed in order with the test, the same order that you just covered with her for the past 2 days, symptoms first, because you covered them in that order in the first 2 days. Cover them in the same order now.
Yeah.
Emphasize normal. And then put a perspective on it. Was it seriously bad? Was it totally normal? Was it just a little bad? Make it relative. If it was normal, tell them. If it was just a little, tell them it was a little. If it was a lot, tell them it was a lot. That creates a lot of trust. Get their agreement. Emphasize which of those tests, which was most important for her. And we already know it's joint motion. It's her x-rays and joint motion. That was the test that's most important to her and her problem. And then those are the 3 categories from a training standpoint. But from a big picture, I'm just saying it's micro agreements along the way.
Yeah.
So stop. When you cover a category, stop. Okay? Because I don't care if you're in that room, long, because that's not what's important now. Because if you never learn this, you're never going to keep patients anyway.
Right.
So I'd rather you do it right and you stay a lot longer in the room, because at least you start doing it right. Well, guess what happens with repetition when you do it right? Guess what happens to the time? Does it increase, decrease, or stay the same that it takes you to do it?
Yeah, decrease.
It'll naturally decrease, but what cannot happen? What cannot happen is you keep doing bad things and then they become habits.
Right.
And then you try to save time. Well, guess what? You're never going to be busy by losing patients like this left and right. There was no reason to lose this patient. Even though time and money was an issue, tell me we couldn't have gotten her to agree to half of $84, go to 2 months, and $42 every 2 weeks, with even if it was 2 treatments a week to the re-exam. Tell me we couldn't have got that out of her.
Yeah, I see how we could have. Yeah.
Yeah.
And she'd already showed up, for the 3 visits.
Right. So she had a degree of trust in you to show up on day 4.
And time, yeah.
Yeah. So this could have been salvaged, but it would have taken a black belt. This was a tough one, but it was tough because you made it tough. You did things to hurt yourself. But those everything's about micro agreements. You got all micro agreements and the bonding rapport day 4, and then you acknowledge time and money and you make it affordable. Who's going to say no to that, Greg?
Yeah.
See? And remember, no matter what clinical question I have, what's the answer?
3 phases of healing as it relates to their biomarkers.
Well, we're going to say test with patients.
For a test, yeah.
It's best under test relative to the 3 phases of healing. And when do we evaluate them? At the re-exam. And that's when we compare the progress of the treatment. Are they getting better, worse, staying the same? Or is there a chance it's heading toward a permanent injury? That's your answer for every clinical question. You understand that?
Yeah.
Memorize it. Write it down. And it's the re-exams. Those are the stop gaps. Those are the targets that you want them to go to as re-exams. So she already nixed long-term care. She said repair. I'm going to do the math for repair, and then I'm going right to the re-exam. And I would have gotten that if I had micro agreements along the way. And even if 3 times a week was too much, I would have went to 2. And if the money 84 was too much, I would have took it to 2 months. You see, I'm going to get those 2 agreements out of her. But you lost trust. That's why she just threw in the test. The good news is she trusted you to tell you. That was the good news. I mean, that was rare.
Yeah.
You know, but you didn't handle it right. You didn't give her a good explanation, and then you forced it. And I told you that's when she was done with you. She just turned you off and said, "I'm third partying your ass."
Yeah.
And even when they do that, I'm still going to end because I know I'm losing them. I'm still going to go for the answer of time or money. What would work with their husband if they told them? Because there's no if they say yes to that, there's no reason for them to say yes now. If they don't, we know it's a trust issue. It's not a time or money issue.
Yeah.
And by the way, I think she would have, even if you would have gotten it down time and money, she still would have nixed you with her husband and said, "Let me check," because you'd already lost her trust now.
Yeah.
You were trying to talk her into it, Greg.
Yeah, I felt like that. Yeah.
And it came across that way. Remember, I don't have to talk anybody into anything. It's their test. It's their problem. I'm just explaining what it is. Here's the good. Here's the bad. Here's how you get from A to B. And then I just go to time and money to make it affordable. It's your choice, not mine. All right, let me leave it like that. But that was a good teaching, learning tape is what that was. All right, Greg, I'm wore out, and I'm gonna leave it.
Could I get this at a recording? Were you able to record it?
Yeah. I'll send. I'll send it.
All right. That'd be much appreciated. Yeah, I guess I'll just talk to you tomorrow then, or Monday.
Hey, let me leave you on a good note because I beat you up. Your persistence was good. You didn't quit. Even though you got the negative, you came back. You got the negative, you came back. So that says a lot, Greg. You didn't quit. Now you weren't good, but you showed confrontation to come back.
Yeah.
You're just going to get smoother with your confrontation. As a matter of fact, you never wanted to get to that point.
Yeah.
It's all micro agreements in all these categories all the way through. That's what it's about.